Danube University Krems, located at the entrance to the Wachau Valley in Lower Austria, was founded in 1995 and is the leading university in Europe that has specialized in postgraduate continuing training. It is a unique model, a public university with private organization and funding. Danube University has been familiar with the special requirements of postgraduate studies and part-time courses for many years, and is able to combine practical applicability, such as is required in the training of psychotherapists, with an academic foundation. Integrative Therapy has been taught at the Department for Psychotherapy and Biopsychosocial Health, alongside other specialist psychotherapy modalities, since 2006. The training and practice of psychotherapy are governed by the Austrian Psychotherapy Act. The brief excerpts of scenes from 2 psychotherapies shown in this film, each of which was carried out over several months, present integrative therapy as a form of psychotherapy that is oriented towards the lived body and draws on a rich pool of theoretical, praxeological, and creative tools. In integrative therapy, the concept of the lived body encompasses the body, psyche, mind of the subject. We're thus purposely choosing this approach to the human being, which is specific to integrative therapy. While it is only one aspect of this psychotherapeutic school, is a highly characteristic one. Each of the 2 excerpts shows a clinical micro-situation, a brief intervention. The focus is not technical psychotherapeutic interventions, but intersubjective processes of co-respondence, which we have attempted to present in a comprehensible way. Such creative interventions focusing on the lived body frequently evolve out of longer-term therapeutic processes, and also often result in them. The goal is to capture processes in a holistic way, to collect objective aspects and subjective impressions. Situational, scenic, and atmospheric contextual factors are also always fundamental in this psychotherapeutic work. A 40-year-old graduate who works as a representative for a drug company has been in psychotherapy for a few weeks for a depressive disorder. 4 days ago, he had a conflict with a client. He had already become very angry during the course of the conversation and continued to be so afterwards. However, towards the client, he behaved as though he were totally composed and relaxed. In the situation itself, his angry impulse led him to clench his right hand into a fist and slightly abduct his right arm. In the situation, neither of these movements was recognizable or perceptible to either the client or the patient himself. In the therapy session following this event, the man, who is of a slim and athletic build, reported feeling a sharp, dragging pain since his encounter with this client. It radiated from his back, between the shoulder blades, into his right arm, and across the back of his neck, up into his right temple and forehead. The doctor who was on duty at the weekend had diagnosed cervical spine syndrome and prescribed him an analgesic. As a result of the persistent pain and the stiff neck that he had developed in the meantime, he had already far exceeded the recommended maximum dose of the medication. An intervention based on the lived body revealed that the patient's anger towards the client, his aggressive impulse towards him, was manifested in the form of a muscle cramp, and was thus transformed into a concrete and painful lived body experience. We're all familiar with this phenomenon in our everyday lives. If we assume an unusual or tense, cramped posture, even if only for 15 or 20 minutes, and do not relax it in some way as soon as possible, it can lead to pain that persists for varying periods.
For the last 4 days, I've had a persistent, sharp, dragging pain. It begins in my back, between the shoulder blades, and radiates into my right arm, stretches across the area, at the back of my neck, where I also feel a stiff neck, and into the area of my right temple and forehead. I can hardly sleep because of the pain, and have been taking high doses of painkillers to keep the pain to a more or less bearable level.
What happened 4 days ago?
It started immediately after the client was offensive to me. There's still a shrinking feeling inside me, and I feel angry when I think about this situation.
Where exactly do you feel it in your back? May I cautiously touch this painful spot? May I touch you on this spot on your back?
Yes.
Can you feel into your right arm and hand? What do you perceive?
What? Why?
May I touch you on this spot on your back again? What do you notice now?
That I'm clenching my right hand into a fist and moving my arm away from my body, sideways.
What's your impulse as you do that? What would you like to do?
Doctor, I can't do that.
Then say what you'd like to do.
I'd really like to push the client away with my arm.
How could we manage the situation here in such a way that you can allow yourself to have this impulse and nothing bad will happen?
I don't know.
May I make a suggestion?
Yes.
Imagine that your fist could talk. What would it say?
I've never done anything like that before.
Perhaps you'd like to start with,
I'm a fist.
now go on.
I'm a fist. I'd really like to punch this client on the nose.
What else does your fist feel? What else does it want to say?
I'm realizing that the client's not the only person I'd like to punch on the nose. Suddenly, many faces are popping up.
Choose 2 or 3 of these many faces.
I see my wife, My father.
Yeah. Which of them stirs you up the most?
My father.
What images come up when you think about your father?
Humiliations.
Can you speak to him directly, as if he were standing in front of you?
You humiliated me a lot. You were never satisfied. I was always the little stupid dunce. I always hung my head. Now it's hurting.
Let's sit down again. Now, how do you understand your pain, your anger, and the impulse in your fist, and the stabbing pain in your back?
There's a connection.
What's the connection?
With my father, I always suppressed my rage and my anger, because wanting to hit him, you don't do that. And with my client, I can't get rid of my anger either.
Does it have to be like that?
No. I don't have to put up with everything. I can find a suitable way of making myself clear.
The practical application of integrative therapy is based on a therapeutic relationship. It takes place in a process, thus it takes time. It's situational and always takes into account elements such as the perspective on the individual or his or her social relationships and ways of looking at things, which have to do with development. It is also based on psychodynamics, systemic and interactional perspectives, and on models of life processes and life situations. In the treatment documentation presented here, a sequence is shown from a treatment cycle that took place over an extended period. As a rule, the process that takes place between the therapist and the patient follows a dynamic course with an initial phase, an action phase, an integration phase, and a reorientation. In the initial phase of the therapeutic process, the goal is to establish what is affecting the patient emotionally in the moment. The situation is then intensified and focused on. The goal is to make a diagnosis and allow a trust-promoting atmosphere to develop, so that a supportive therapeutic alliance is established through contact and encounter. In the initial phase with this patient, he described the sharp dragging pain that he had had for 4 days, and which radiated from his back across the back of his neck into his right arm.
It begins in my back, between the shoulder blades, and radiates into my right arm.
The process in the action phase centers on the patient's perceptions of his own movement impulses, and his gaining a better grasp and understanding of his movement processes through identifying with them.
What do you notice now?
that I'm clenching my right hand into a fist and moving my arm away from my body, sideways.
What's your impulse as you do that? What would you like to do?
I'd really like to push the client away.
In the integration phase, this patient tries to make sense of what he has experienced in the preceding action phase. In this phase, the aim is to render the patient's experience as conscious and clear, to capture the meaning of what has happened and its significance. Talking about the patient's thoughts and feelings and about the experiences he has put into action enables him to comprehend them and thus to integrate them. In practice, this comes about through the therapist's emotional participation in the patient's experiences, and sometimes through his disclosing his own experience and giving feedback on what he has observed.
Now, how do you understand your pain, your anger, and the impulse in your fist, and the stabbing pain in your back?
There's a connection. With my father, I always suppressed my rage and my anger. Because wanting to hit him, you don't do that. And with my client, I can't get rid of my anger either.
In the reorientation phase, patients implement what they have integrated in their everyday lives. In this phase, their initial steps can lead to new kinds of actions, or new sequences of actions, which are often quite creative. They can take time to try out different variations. In this example, this could mean that the patient will not put up with everything, not swallow everything, and will defend himself appropriately, both verbally and with his gestures, facial expressions, posture, and movements. Plans that have been elaborated can thus be rendered more precise, modified, or falsified in order to make them even better in practice. This treatment documentation shows a conflict-centered uncovering process. In addition to this modality, there are others within the multimodal praxeology of integrative therapy. For example, the conservative and supportive, palliative, experience-centered and stimulating, practice-centered and functional, and network-activating modalities. Integrative therapy has a differentiated theory of health and pathology. The 4 ways of healing and facilitation contain factors that are relevant for efficacy. The vignette presented follows one of these 4 ways: awareness work. In the practice of integrative therapy, there are different depths or levels of therapeutic work. In the action phase of the present example, the level of experiencing in images and involvement was reached, where outer reality recedes and feelings are experienced and expressed as vividly as if the patient were actually in the situation. It is important that the therapeutic relevance does not depend on a certain depth or level being reached, and that the risk of re-traumatization is avoided. The therapist's task is to start from what the patient shows, the phenomenon, and use it to further multiple healing and development processes. The patient is approximately 25 years old, single, and the oldest of 5 siblings. Diagnosis: generalized anxiety disorder. The patient underwent several medical assessments, as due to her physical symptoms, she was very afraid of becoming ill. She linked the pressure she felt in her chest with the fear of having a heart attack. The results of an ECG and other examinations were normal. She came for psychotherapy on the recommendation of her general practitioner. After roughly 10 sessions, the process shown here was possible. The patient describes the physical sensation that she has had for years and which is becoming more and more pronounced and conscious. When falling asleep, she has a sensation of pressure in the chest region. The psychotherapeutic work starts with her physical sensation. which becomes easier to talk about through creative expression. She describes the sensation of pressure in words and then draws it. During the drawing process, scenic memories emerge, and the patient becomes sad.
How are you today?
Not so good. I had difficulty falling asleep again. The pressure in my chest is still there.
Describe the pressure to me again exactly. How does it feel? Is it hard? Tight? Stabbing? Or is it diffuse, unclear?
It's so unclear, so diffuse. I can't feel it exactly.
If you could find a colour for this unclear feeling, what would it be?
I think gray, dark gray.
If you were to give the colour a shape, what would it look like? Try to make the shape with your hands. Would you like to, or could you, draw a picture of it?
Yes, I like drawing.
I have some wax crayons here. There are some fat ones and some thin ones, some felt tip pens and colouring crayons. Which would you like to use?
I'll take these.
Please choose a piece of paper in the size you want and a place where you'd like to draw.
I prefer the floor. I'll take this paper.
Try to draw the impression that you showed me with your hands. I'll watch you if you like.
Yes, please do. What are you feeling now? What sensations are you having? I've suddenly started to feel sad. While I was drawing, my grandmother came to mind. With her, I would always sit on the floor and scribble. She liked it when I did that, and never criticized me like my parents did. But then she suddenly died. I was 5 years old at the time, and nobody explained to me why she wasn't there anymore. And then I had nobody to watch me drawing, or to be pleased with my pictures anymore.
Your grandmother was a very important person for you. What would your grandmother say if you couldn't sleep?
She would put her hand on my head and say, "Everything's okay. Good night, my love."
Oh, that's great that you can remember. Now you can imagine these words and put your own hand on the place where you feel the pressure. Perhaps it'll be easier to fall asleep then. Why don't you try it out?
I'd rather try it out at home. I'll take the picture with me to remind me of my grandmother. She's the red heart.
Good. You can do that to calm yourself down and comfort yourself if you feel the pressure again.
Creativity and creative media are important elements of integrative therapy. For many patients, creative methods and media make it easier to express themselves and communicate. The therapist's ability to find a new way with each patient arises from the human capacity to develop through creativity. There are many ways of expressing themselves, and they're striving towards self-efficacy. The interventions develop out of the intersubjective contact and therapeutic relationship, and are employed in a way that fits in the respective situation. The therapist asks the patient whether she can follow her suggestion and put it into action.
Would you like to, or could you, draw a picture of it?
Yes, I like drawing.
Creative media are another way of working towards healing in integrative therapy and lead to new and expanded communication experiences. The goal is for these experiences to take effect in the patient's everyday life. In this case, the effect on the patient is the idea that she should learn to calm herself.
Now you can imagine these words and put your own hand on the place where you feel the pressure.
The practice of integrative therapy includes a set of creative tools, which therapists use to get closer to the needs of their patients and to search for suitable options for action.
Why don't you try it out?
I'd rather try it out at home.
Techniques in integrative therapy structure complex situations. They include, for example, perception exercises, techniques of improvisation, role plays, movement interventions, and imaginative techniques. In this vignette, the starting point was the patient's perception of her body, from the gesture to the movement, and from there to the image. From there back to the body, the lived body, and self-touch. Media are a means of stimulating communication and interaction. They also include materials that trigger movement and feeling. Scarves, sticks and ropes, costume materials for improvising scenes, dolls, pictures, artist's colors, and modeling clay are employed. They promote patients' verbal and non-verbal expressive skills. In therapy sessions with the patients, artistic and creative approaches offer as open and creative an orientation as possible. As far as possible, they're also oriented towards the patient's capacities and conditions.
I prefer the floor. I'll take this paper.
Creative and artistic media are used to expand patients' experiences, to promote self-understanding and deepen the therapeutic process. In the sitting position on the floor, the patient was able to remember a scene from her past. The therapist facilitated this atmosphere and then the retrieval of the memories, probably partly through her open and benevolent attitude.
What sensations are you having? What are you feeling now?
I've suddenly started to feel sad. While I was drawing, my grandmother came to mind. With her, I would always sit on the floor and scribble.
The creative methods of integrative therapy provide a means to find alternative modes of expression for our inability to put what is atmospheric and frequently overwhelming and unspeakable into words, and to counteract multifarious alienation processes. The patient was not aware of her pain at the loss of her beloved grandmother.
She's the red heart.
Good.
She somatized it. She was only able to find words for it and ways of expressing it with the help of the therapist's attentive support.
You can do that to calm yourself down and comfort yourself if you feel the pressure again.
In integrative therapy, movement, images, symbols, and other techniques are used in addition to reflection and verbalization to express what is unspeakable and atmospheric and what is felt. As these two brief scenes show, a rich and original repertoire of treatment methods, techniques, and creative media can lead patients through what are termed intermedial crossways in a therapeutic sequence. In the two treatment vignettes presented, using the crossways of perception of the lived body, movement, images, and scenes opened up new perspectives and helped the patients to experience links with their histories.